Good day, and thank you for joining us for the Medical Tourism Association's webcast for travel professionals. My name is Charlie Rodriguez. I am the Marketing and Engagement Coordinator for the Medical Tourism Association, or MTA. The MTA is the world's first nonprofit, membership-based trade organization for the health and wellness travel industries. We publish the Medical Tourism magazine. We host the most visited medical tourism websites on the internet and organize the largest trade show and exhibition in the industry. We hope you'll join us live November 3rd through 5th at Caesars Palace in Las Vegas for the 6th World Medical Tourism Congress and witness firsthand the opportunities and spirit of collaboration in this thriving industry. Our presenter today is Jonathan Edelheit, CEO of the MTA. Jonathan is an industry professional, expert, and visionary. Jonathan is a trusted advisor, and he's been asked to speak all over the world on medical tourism. So please help me and join me in welcoming Jonathan Edelheit.
Thanks, Charlie, for that introduction. Hello to everyone on the call. Good afternoon, good morning, good evening, depending on where you are in the world. I know we've got people from all 5 continents around the world listening. So we're going to be covering wellness tourism and also medical tourism with a little bit of a heavy focus on wellness tourism and discussing the travel agent's role in medical tourism and wellness tourism. So obviously, I think that, with changes over the past, decade or so, travel agents are looking to find new opportunities, how to access new niches, new segments within the travel industry, and how to be innovative, because obviously innovation leads to new revenue and income sources. So obviously, I think wellness tourism is one of the fastest growing trends in travel and is going to be one of the dominant new, innovation and disruptive technologies and information out there going forward. So when we look at wellness tourism and medical tourism defined, it's people traveling from one country or city to another country or city for medical and or wellness services. And that's going to vary based upon affordability, accessibility, availability, and quality, the perception of the destination, and what value that means to the actual consumer. I think perception of the destination is extremely important because people are going to travel to a destination that they feel safe in, that they believe in, that that it's a culture that they would like to be a part of, and a society that they'd like to be a part of. No matter how amazing a wellness or alternative treatment is, or even a medical procedure, people are not going to travel to places that are unsafe or they're uncomfortable in. So if we look at the history of medical tourism and wellness travel, this is not a new phenomenon. Individuals have traveled abroad for wellness and health benefits from thousands of years ago. From Roman and Greek baths to in England, hundreds of years ago, where people would, travel to take the waters from a spa in a specific town. In this example, in England, people are used to traveling for these types of treatments. If we look at the history of people traveling for medical procedures, comprehensive medical procedures, that's been going on for over 100 years. But during the latter half of the 20th century, we've seen a lot of wealthy people from less developed areas of the world starting to travel to developed nations to access better medical expertise and technology. And some examples that we just look in the U.S., the Mayo Clinic, Johns Hopkins, MD Anderson, people travel all over the world. There's a lot of people going to Western Europe. And over the past couple of years, it's been an explosion and a boom in health investment in healthcare quality, infrastructure, and systems. So now people travel from almost every country to all countries all over the world. And it's not just limited to developed countries as having the best hospitals. Now the developing countries have amazing hospitals also. So what are some of the key differences today and why borders have broken down and people are traveling more for wellness and also for wellness procedures and care than ever before? It's, affordable, accessible travel. Flying on airlines can be very economical. Easy access to information on the web. I think this is one of the biggest reasons why there's been a growth of the international travel is people are going online, they're Googling, and they're looking at I want this type of wellness treatment that's going to, take care of this one need for me. Where are the best places to go for it? And they can get information at the tip of their fingers instantly from places all over the world, and the same thing with healthcare. And we've also seen a tremendous amount of growth of healthcare and wellness clusters. And these are both, organizations that are emerging that are kind of like, membership-based in a city or country, where it's the public and private sector, the government, the hospitals, the wellness providers coming together and starting to create a brand for their city or country and attracting wellness consumers or healthcare consumers. So if we look at who are the stakeholders in medical and wellness travel, like who are all the different players, it's really everyone. This is a big circle of care and a circle of service that's comprehensive. And so you have under this banner medical providers, tourism providers, logistical, public institutions, organizations, accreditation agencies, and then we look at the market. So under the medical providers, you've got hospitals, clinics, and doctors. Under tourism, you've got airlines, hotels, travel agencies, transportation companies, tour operators in the local countries. You've got medical tourism facilitators. You've got ministries of tourism and other government organizations promoting it, supporting it, passing laws to financially support it or making it easier for people to get visas to come into countries. You have healthcare clusters, chambers of commerce, wellness or spa associations, and medical associations promoting it, universities. You've got quality accreditation like JCI. You've got self-pay consumers. You've got corporate consumers for their employees. You've got insurance companies. So a lot of different players, and they all need to come together to really solve this, the issue of providing a positive experience in a circle of care. So if we look at the value and growth of wellness tourism alone, not medical tourism, but people traveling for wellness care, it's estimated at $2 trillion US, and this is by SRI, who did about 2 years ago an independent study, and they're a nonprofit research institute. And $1 trillion of that came from the U.S. in 2012. And there's an estimated 5% annual growth. And if we look at, this chart, which is from the SPAs and the Global Wellness Market report, this examines wellness as a $2 trillion industry, but different segments within it. So within wellness, we have spa. It's about a $60 billion. We've got complementary and alternative medicine, healthy eating, nutrition and weight loss, preventative and personalized health. You've got medical tourism, you've got wellness tourism, workplace wellness, fitness and mind, body, and beauty and anti-aging. And you've got conventional medical-oriented approaches and integrated wellness-oriented approaches. So one that solves problems, medical problems, and one that's there to improve the quality of life. So how far-reaching is wellness? According to SRI, there are about 289 million wellness consumers and growing, and the majority of consumers came from the 30 most wealthy or most industrialized nations. If we look at wellness in the modern healthcare landscape, there's two types. There's proactive versus reactive, and wellness is proactive. It's acting before healthy people become sick, and modern medicine is reactive, which is acting once a person becomes ill. So for the wellness consumer, more research is needed, but there's two categories for wellness, the wellness-focused and the sickness reactors. Wellness-focused consumers are those consumers that are moderate to active spa goers and open to new ways to approach health and exercise, and they may be motivated by the effects of aging or other motivating factors. The sickness reactor consumer are people with a health condition seeking a new or alternative approach to treat their condition. And this segment represents a potentially much larger segment of the population. So where are wellness tourists going? Traditionally you've seen a lot go to Scottsdale, Arizona, Paris, France, Mexico, Croatia, but the reality is it's everywhere. This is something that's totally international. And if you asked 5 to 10 years ago where they went, you could name those 5 or 10 hot locations. But now there's hundreds across the world, and this is truly global. So if we look for a little bit about what is medical tourism. Medical tourism is healthcare consumers traveling either domestically or internationally for healthcare services. And it's important to identify the two. There's domestic and international. So there's people within a country that are traveling to different cities, regions within the country to get the best medical care that they can. And then you've got international medical tourism, which is healthcare consumers who are traveling outside their country to get care. And the driving factors are affordability, accessibility, and availability. So affordability is a patient or healthcare consumer traveling from their country, which could be more expensive, to a country that costs less. So this could be someone from the Middle East going to India. It could be an American going to Latin America for care. It could be a patient from Singapore going to Thailand for a medical procedure. So cost factors. Accessibility is it could be a Canadian or a UK healthcare consumer that there is a long waiting time, and so they want access to immediate care. So they make that decision to leave from the socialized medicine and the long waiting times where they might have to wait a year or longer for an implant for a knee or a hip or orthopedic, so they decide they want it right away. And availability is getting a procedure that you can get right away in another country because it's simply not available in your country. So, you know, if we look at, you know, even famous people who've traveled, I'm sure you all know Steve Jobs from Apple. He actually went to Europe just before he passed away to get cancer treatment that was not available in the United States. And he actually, you know, one of his regrets in his memoirs was that he didn't try to seek alternative treatment sooner. So there's a lot of people traveling for care that they can't get in their home country because it has not been approved. So when we look at what services do they seek when healthcare consumers travel, they're going for orthopedics, hip, knees, back, and spine, cancer treatment, heart procedures, transplants, dental treatment, bariatric surgery, alternative medicine like acupuncture, stem cell treatments, cosmetic surgery, infertility and rehabilitation, and geriatric care. So how big is medical tourism? You know, it's estimated by the OECD that there's anywhere from 50,000 to 60 million medical tourists. Nobody knows because nobody's been tracking it. You know, I feel there's a conservative estimate there's at least 5 million patients traveling internationally and growing every year. There's just a large number of patients, and it's not from just 10 countries to another 15 countries. It's literally everywhere in the world. You have a constant inbound and outbound flow. So, for example, you might have healthcare consumers in Kenya who leave and go to India for, they're going for less expensive treatment, or they're coming to the U.S. For very comprehensive and cutting-edge procedures. And then you might have people from Tanzania, the country right next door to Kenya and Africa, who they're coming to Kenya because Kenya's medical procedures are more advanced than their country in Tanzania. You could have U.S. patients who are traveling to Latin America for less expensive care, and then U.S. patients who are going to Western Europe for expensive care that's just not available in the U.S. So there's a constant stream, and it's global. Every country has inbound and outbound care. So medical tourism is really growing very fast because it's a top priority for most governments. The Ministry of Tourism, the Ministry of Health, and the Ministry of Economic Development are all getting involved because it has a very positive impact on the local economy. For the Ministry of Health side, when a country gets involved in medical tourism, then the private sector starts investing in their health care and the quality. And there's a trickle-down effect and a trickle-up effect, whereas the private sector's quality starts going up, so does the public sector. Ministry of Tourism is doing it because there's a huge economic impact on the tourism side to the local economy, the hotels, the tour operators, the restaurant, and economic development is getting involved because when they help invest or provide incentives for this industry, more people come and invest in the sector. So if we look at medical tourism as a revenue source, you know, the United UNTWO, you know, said that about 1 billion tourists traveled internationally, the World Tourism Organization, in 2012. That's 1 billion, and this number is growing significantly. Medical tourists spend between 5 to 10 times more than a normal tourist, and that range is varies. These are statistics from different countries. but they're spending a tremendous amount in the local economy, shopping, going to restaurants and the hotel. And countries around the world have reported these figures, and it depends on the type of procedure and activities they're doing of how long their stay is going to be. So obviously, if you're coming for a very simple procedure, cosmetic, you might return back to your home country much faster than if you're going for an implant or a heart procedure. And a 2011 survey that the Medical Tourism Association conducted found that over 80% of medical tourists traveled overseas and brought a companion. And a recent survey that is about to be released, a 2013 MTA patient survey, found that 60% of medical tourists indicated staying in their destination countries for more than 10 nights. So when travel agents look at, what do I want to get involved in, and what is my liability? Obviously, when they look at wellness travel and tourism, there's not much liability or issues. When they look at medical tourism and they say, I'm going to help send a consumer to go for a heart procedure or a knee implant or cosmetic, a couple of the main concerns of travel agents are, what about the quality and what about the liability? So if we look at, quality, there are accreditation agencies out there. There's a Joint Commission International, which is a U.S.-based accreditation organization. There's ISQA, which is the accreditor of accreditors that accredits a lot of country accreditation systems. So there are quality accreditation out there. And if you work with a hospital that has an internationally recognized accreditation and a quality accreditation system, you really shouldn't have to worry that much about liability. But you also want to make sure that you're looking at the doctor and who is this doctor, what is their credentials, and are they the top surgeon in their field? Because if you have a top surgeon and you have a top hospital, that's going to really reduce your liability tremendously. But obviously, there's always complications in medical care. It doesn't matter if it's the best hospital in the world, the best surgeon in the world. There are complications. It just happens when there's medical care. So obviously, some of the things that can help against that is a proper waiver, making sure the consumer signs a waiver, indemnifying and limiting the liability against the travel agent, that there's proper insurance secured to protect the travel agent, that, as I said, they're choosing the right hospital and doctor and choosing the right facilitator. And I'll go into medical tourism facilitators a little later. So with medical tourism facilitators, these are the intermediaries who help coordinate the care, the middlemen between the patient, the healthcare consumer, and the hospital and the doctor. So there are different variations of facilitators, just like there's different variations of travel agents or doctors or lawyers. You're going to have great ones. You're going to have ones that are good, ones that are average, and then you're going to have ones that are poor. There are ones that they steal money from healthcare consumers. They refer healthcare consumers to hospitals and doctors that are not the best because instead they're focusing on commission. So you really, if you're going to work with a medical tourism facilitator, you should really work with a quality one and one that's transparent. So, that's your reputation, and that's going to be the experience of your customers is working with this facilitator. And travel agents have to make the decision. You have the option to work directly with the hospital. A lot of hospitals work directly with travel agents. You can work with a facilitator, and they can coordinate everything between the patient and the hospital. Or there are some travel agents that have made the decision to become a medical tourism facilitator. Obviously, this is not something where you just wake up one day and say, I want to become a medical tourism facilitator. There's a lot of work that's involved. It's very intense. There's liability. There's other things. So a lot of travel agents just prefer to say, I'm a travel agent. I book travel. I know what I do best. I'm going to find a really quality medical tourism facilitator to deal with all the stuff that has to do with the patient and their medical issues and the service there. And I'm going to focus on just having the relationship with my customer and getting more customers to want to travel for medical tourism or wellness tourism. Now, one thing I'd really like to talk about is dental tourism. Dental tourism and dental travel is going to be huge in the future, and I think this is an area that every travel agent should be focused on. There's huge savings from people going from developed countries to developing countries for dental care. The cost, for example, in the United States for dental implants it's totally, absurd. People, the cost range, but I've heard of people having to pay $50,000 or more for a whole set of dental implants for all their teeth. And the cost when you go to Latin America can be, or even Asia, can be up to 90% less. And this is a perfect example. People from Western Europe go to Eastern Europe for dental care because they're a great dentist and the cost is significantly less. But also with dental tourism, besides the less issues, you're dealing with less problems. You don't really have to deal as much with the quality issues. And when I say with that, obviously you need to make sure you're working with a quality dental clinic and a quality dentist. But you don't have to deal with the quality accreditation issues because you're not going to have people really, you're not going to have issues where you got to worry about people having heart attacks, bleeding out, other things that could happen with a medical procedure. There's very limited issues that come up with dental care. And so you have limited liabilities, and you have to deal with limited complications. So more positive outcomes, controlled risk. And so this is going to be one of the biggest areas we're going to see grow in people traveling for wellness and medical tourism. Plus, you can easily combine a vacation with dental treatment. So you're going for implants. It might take you from a couple days to a week or two. So it's perfectly positioned to be, why not take it as a dental vacation and be in a beautiful place to actually get this done. And I think that's really important too, because if you go for a cosmetic procedure, for example, you get a facelift. You got to make sure you're not in the sun. If you get dental care, you can be in the sun. And so, we're seeing a lot of travel for dental tourism, and we think we're going to see a lot of dental insurance companies picking up and offering this to the dental insured that they have. And one of the important things that I'd like to talk about regarding tourism, obviously people go for wellness tourism. They're engaging in things that are going to rejuvenate them, relax them, and they're going to engage in a lot of local things. So for medical tourism, some people say, well, are people really going to engage in tourism? Yes, people are going to engage in tourism. And there are people out there that try to, they go to an extreme. For example, I was on Fox News about a year ago, and I was invited to speak on medical tourism and why Americans are traveling to Latin America. And they brought the president of the American Society for Plastic Surgery on to talk, and he was there to say, don't travel for medical care, it's dangerous. And they even have a video they developed that was an anti-medical tourism video that shows a consumer a female consumer in a dark room, talking about how she traveled and had a bad experience. It was all fictitious. It was an act, but it was just to scare people from not wanting to travel for any type of care. And on the episode, they said, people really shouldn't travel for medical tourism, and someone's not going to go and get a major procedure and then be on a wave runner riding around on the water. Well, yes, I think that's common sense that that's not going to happen, because their doctor is going to advise them and say, here are things that I recommend you could do or not do. You're not going to get a heart procedure and then go bungee jumping. But people are doing it, and I think it's almost like 80–90% are engaging in tourism, and that tourism could be going out to a restaurant, going shopping. We did a documentary called Angels Overseas, where we filmed an American who went to Costa Rica for a double knee replacement, and he was so excited. He never traveled before. He never had a passport. He wanted to eat food from a local street vendor, and he went on a tram tour above the rainforest. That was an automated tour, and this is someone who was going for a double knee replacement. Seeing people who they're getting a heart procedure, and they go to India and they go to see the Taj Mahal before their heart procedure. So people do tourism, and it's just common sense, doctor recommended, travel and tourism. Now, corporate wellness. I'd like to touch a little bit about this, because I think this is a huge opportunity for travel agents in the future. And I do a lot in corporate wellness with big multinational employers and employers all over the world. And this is taking wellness to the corporate side. Healthcare costs are going up all over the world, and a lot of employers are trying to engage their employees in being healthy. And so they're implementing wellness companies within their organization. It's a multi-billion-dollar industry and growing significantly every year. And so the idea upon this is employers are putting in programs and paying to try to get their employees to be healthy because they believe that they're more healthy, they'll be more productive, they'll be absent less, and their healthcare costs will be reduced. So the company's costs go down, and they become more profitable because of better productivity. So what a lot of employers are doing is they're offering incentives for employees to get healthy and participate in their wellness programs. So if they participate in their wellness programs, they might get incentives. It could be a gift card, or if they hit certain targets, they get a gift card, or that incentive could be anything. So one of those things that a lot of very creative and innovative travel agents are doing is they're saying, why don't we make that incentive to be travel and hotel, like sending them on a spa or a wellness vacation. And so they're starting to talk to corporate employers regarding trying to put these types of incentives in place versus the previous types of incentives that they did. And it really makes sense because if an employee is able to take a vacation, they otherwise wouldn't, even if it's for a short or long weekend, when they engage in spa, they're going to be more relaxed, and more balanced when they go back to work. So an area that's really overlooked when we look at the wellness market and the medical tourism market for consumers and travelers is ethnic travelers. I think that, what we've seen is a lot of people focusing on core people. So, for example, if we look at the United States as just an example, there was a study done several years ago, and it was in the low 30s. I think it was like 30% or 32% of your average Caucasian white Americans said they would travel overseas for medical care, like orthopedics or cancer treatment or heart, if the quality was equal to or better than they can get within the United States. But when they had that same sampling and asked ethnic Americans, 54.1% of Hispanic Americans said they would do it, and 56.8% of Asian Americans said they would do it. Now, with that is those statistics should really remain consistent no matter where you are in the world. And I think we know all over the world the demographics are changing. So if you go in Europe, you're going to have a high, population of people of different ethnicities. And these is a very niche market that most travel agents should really go after. And the whole reason why is when you're dealing with an ethnic consumer, you don't usually have to deal with cultural issues or language barriers. So if you're dealing with someone who is of Filipino descent or from the Philippines, and you tell them go back to the Philippines for, to engage in wellness tourism or go for a medical procedure, they don't need to think about, is the country safe? Are the doctors quality? Is the hospital quality? Is the wellness services, some of the best that's in the world? What are the people like? What's the language like? You've eliminated all those barriers, and it's a place they can be very comfortable going to. So I think it's a very big focus, and focusing on targeting those individual consumers of ethnic descent, but even more importantly, targeting even corporate employers or groups that are ethnic organizations. Now, a huge opportunity in the future is going to be the silver tsunami, and those are the elderly people coming up. There's a huge baby boomer, all over the world, no matter where you are, and there is a huge demand that's going to be a big problem for the world going forward. And, it doesn't matter where you are in the world, the elderly are going to put a huge demand on wellness and medical care in those countries. So if we look at a study just from the United States by the American Hospital Association that was done a couple of years ago, by 2030, almost half of Americans will be over 50 years old. More than 6 out of every 10, that 50% of the baby boomers will be suffering from multiple chronic conditions. And by 2030, 10 times the knee replacements will be performed than today. That's 10 times the number of knee replacements. That's huge. So that means, like, for example, in the U.S., going forward in a very short period of time, the U.S. healthcare system isn't going to be able to provide the number of knee replacements that they are today. So patients will start having to travel for knee replacements. And this is going to happen all over the world. If we look in places like Japan, there's the huge issue of there's a lot of elderly and there's not enough young people to support them. If we look in China, there was the one baby policy. So now you've got elderly and you don't have the children to help financially support them or deal with their health care issues as they get older. So there's going to be this huge weight and crush on the healthcare and wellness systems around the world, and these people are going to be the ones that travel for care. And some of the things to think about is there's a lot of alternative treatments that people do not know about, that if they did, they would travel. And that's where the travel agent can come in and really help educate the people. So, for example, if you have the skin conditions like psoriasis, then a lot of people don't know that you can go to the Middle East and you can go to Jordan or Israel and go to the Dead Sea and spend time in that water. And because of the high salt content and the chemicals, people are having the psoriasis, go into remission, or it really just eliminates and reduces the inflammation and all the issues that they have. And what they've actually found is it's cheaper to send them to the Dead Sea than it is to treat them with prescription drug medicine. So there's a lot of European insurance companies that now actually reimburse their insured for a trip. They pay for the hotel, they pay for the airfare and everything to go get this treatment in the Dead Sea. And to me, that's pretty amazing because a lot of people don't even know that exists. And when they hear, they say, insurance companies actually, they're paying for that? And yes, they're paying for everything. So, educating the consumer market on that these services are available, and also looking and finding those types of procedures that are out there, and making it aware to the consumer, to the insurance company, to the employer, so they start providing it, it's going to open up a lot of doors going forward in the future. So if we look at what the target market is for travel agents, you have individual patients, and then you have the corporate market. And you have to make the determination which market you want to go after, or if you want to go after both. Obviously, you have individual consumers are segmented by, you have to look at how you're going to target them. So you're not going to go out there after everyone for everything. You can't do that. That's like trying to go into where I'm sure some of you have done it, or we've all experienced it. You go into a restaurant, and they give you a menu that's like 20 pages long, and they've got every type of food on the menu. They've got French, Italian, they've got American, they've got Chinese, where maybe they don't do everything really well because they're doing so many. You need to be able to focus and create that niche for yourself. So determine what wellness tourism packages you're going to do, or what medical procedures you're going to offer. What geographic location do you want to offer those in? What demographics you're going to deal with, what type of age of a person you want to target, what race or ethnicity, what religion, what education, what income level. And then you have to really think about what's the value of that target consumer, what are their interest, attitude, and lifestyle changes to determine what services you're going to provide and what markets you're going to make available. So if we look at some of the differences in the corporate versus the individual market, the corporate market's very relationship-driven. The individual market is very service-driven. And I'm not saying it's not relationship-driven, because it still is. You need to build a relationship with that individual. They're not just going to get on a plane and go to another country for a wellness treatment or for a medical procedure without building some kind of a bond. But if you look at corporate markets, it's a much smaller target market to go after, where the individual is a very big market. The corporate market's a longer sale process, where the individual can be shorter. In the corporate market, the buying decision could be based upon reducing costs or increasing profitability, reducing absenteeism, where the individual side could be based upon price or certain desire. In the corporate market, you usually have multiple decision makers you need to get approval from, where with the individual, it's just one or two decision makers, usually that individual or their spouse. And we've done studies, and a lot of times we're finding it's the wife or the female in the couple that's the main decision maker. In the corporate market, you have to do a lot of face-to-face meetings with decision makers, where with individuals you're going to have a lot of communication by email and phone. Now, if we look at some of the best practices with travel and medical services, and it's very difficult because I'm trying to sum up in a very short period of time everything that you have to do as a travel agent to get involved in this, and it's a lot. I mean, we have a certification program for travel agents, that's, like 8 to 10 hours, and it's got like, hundreds of slides. So I'm just trying to cover the main points to give it, general understanding, is things that have to go into making sure you have a good patient experience, consumer experience, coordinating video calls between the healthcare consumer and the surgeon if it's a medical procedure, helping with visas and passports, flight, lodging, and transportation, sometimes collecting payment if it's required by the medical facility, providing in-country cell phones, tours and sightseeing, a main point of contact while the person's at the hospital, and following up with the consumer when they come home. And a lot of this, these are services as a travel agent you're providing now. There's just a little bit of nuance and change to it. So obviously, I think one of the most important things a travel agent's going to ask is, how do I make money? What's the opportunity for me for revenue? And there's a couple different revenue models. For example, if you're a medical tourism facilitator, a lot of times they'll charge, a fee that the medical provider or the wellness operator or facility will provide a commission to the facilitator. So that facilitator could share with you in the commission. If you're working with the facility directly, you would get that commission. Or if you're the facilitator, obviously, you would get the commission. And then sometimes there's referral fees, or there's set fees that are charged to the consumer for facilitating that trip. So they're paying for the hospital or the wellness retreat separately in the hotel and airfare, and they're paying a set fee to the travel agent and or the facilitator. So obviously, commissions on lodging and tours and airline, which as a travel agent you're already aware of. So now you're just adding a new component of new revenue that you're able to get on top of the existing one that you're used to. So it's some important things to think about as you move forward with wellness tourism or medical tourism, is set realistic goals, develop action plans and timelines to reach your goals, and measure the results. So we look at setting realistic goals. You need to have a well-positioned website, up, and you determine, I want to have this up by the end of the year, by January 1st. If I want to go visit 5 hospitals or 5 wellness retreats in the next 3 months and choose who I want to work with. I want to have contracts with 10 hospitals or 10 wellness retreats by the 2014. I'd like to have 100 customers by the end of 2014. I'd like to achieve sales of 200,000 by 2016. And I'd like to, because of my growth, be able to hire X number of employees that'll be working for me by whatever date that is, 2014, 15. You have to set up your own goals and determine what it is. For a medical tourist, for example, they spend on average, it could be $7,000 to $15,000 just, on their medical tourism part of the trip. And you have to determine what revenue model you're going on and how many patients you'll need to hit those sales volumes that you would like to hit. So obviously, you need to set reasonable expectations. Becoming a successful travel agent in wellness and medical tourism, it doesn't happen in the blink of an eye. You can't just put out a shingle, throw something on your website, and all of a sudden the consumers are going to come to you. It's a process that can take months, and success is often dependent upon external factors such as the economy, competition, the quality of your wellness retreats and hospitals, their prices, what's going on, and then obviously the individual expectations and need of that traveling consumer. At the end of the day, though, it's all about the consumer experience. You have to provide the most amazing, positive consumer experience that you can. And this is, this industry is all about word of mouth. So if you provide a positive experience, you're going to have that one consumer is going to turn into 10 consumers, and then eventually 100 consumers, and then eventually it could be 1,000 consumers, because they're going to refer their friends, and then their friends are going to refer their friends. So it's a huge network. But that means if you don't have a positive experience because you haven't chosen the right wellness retreat, the right hospital, the right facilitator format, then you're not going to grow your business, because you're going to have a patient or a consumer with a bad experience who's going to share that with their friends. So you really need to over-deliver and exceed expectations. Now, obviously, going back to an action plan, develop your business plan. Identify your target market. Identify the wellness traveler or the healthcare consumer's needs in that market, and choose your partners wisely. And then obviously, a big part of this is you have to start going out and marketing. I definitely like to invite all of you to the 6th World Medical Tourism and Global Healthcare Congress. This is November 3rd through the 6th in Las Vegas. It's the largest medical tourism conference in the world. We get about 2,000 attendees from almost 100 different countries. And it's where you learn from all the top international leaders in wellness travel and medical tourism about best practices, what they're doing. And then there's a networking platform where you can schedule one-on-one networking meetings and connect with potential business partners. And then within it, there's actually, for those travel agents looking to get into corporate wellness, there is a corporate wellness event that's within it where all the, you get a lot of U.S. and employers and international employers who are doing corporate wellness that are coming, and it's the biggest corporate wellness event in the world. So there's a lot of opportunity to really come, learn, interact, figure out your business model, and go connect and try to do new business. And there's obviously wellness retreats that come. There's hospitals that come, so you can meet all your partners. There's be over 100 speakers. We have a big ministerial summit where we bring in ministers of health and tourism from all over the world. And this is just a little bit of an attendee profile, who really comes to the events, from the insurance and the employer sector to healthcare providers to wellness stakeholders to medical tourism facilitators. So we have a buyers program where we bring in a lot of hosted buyers, and you can, as a travel agent, apply to be a hosted buyer and try to get a complimentary pass by going to the website medicaltourismcongress.com and clicking on that under travel agent and applying for a pass. I definitely would advise, if this is an interest to you, to really get into this industry, is to become a certified medical tourism specialist. This is a certification program offered by the Medical Tourism Association, and there's 2 ways to get it. You can actually do it at our conference and attend a workshop, or you can do it online at your own pace. And the online, it's available immediately, and you can go online, and it's all video-based learning so that you can, kind of really view the presenters, go through the modules, and then there's a workbook that's involved and a textbook, and then there's an exam at the end. And if you pass the exam, you become certified. And you really learn the best practices in wellness travel and medical tourism. It's a 2-year certification, which includes 2 years of membership in the MTA. We provide leads, consumer leads, and you can really connect with other members of the MTA. Now, also for those of you maybe that certification isn't fit for you right now, I definitely would invite everyone to look at benefits of joining the Medical Tourism Association. Increasing your networking opportunities, 2-for-1 registration to our annual medical tourism conference, access to market research. There's a lot of different benefits of joining the MTA. We're truly a global organization. We have representatives all over the world. We do workshops all over the world. So we're always looking for, partners in different parts of the world. So if you have a lot of relationships with the wellness providers, the hospitals, the Ministry of Tourism in your country, we'd be happy to, for you to reach out to us and look at how we can coordinate and work together and do workshops and work with you to promote that destination or country. And we're really here for, any questions that you might have, whether it's on this webinar or if it's after the webinar. So with that, I would like to turn it over to Charlie, maybe to open up with questions. Does anybody have any questions?
Yes, Jonathan. The first question is, how do I get started, and what can the MTA do to help me get started?
I think for getting started, this is not an industry that, as I said before, you can just put a shingle out on your door or something on your website and say, I'm doing this now. One of the first things I'd advise you to do is find, maybe reach out to other travel agents that are doing this or other facilitators and get their advice, because you really want to build a solid business plan. And what you really want to do is you want to move into this space in a fast way. Obviously, I'm a big proponent of, our certification as a certified medical tourism specialist, because if you learn the best practices and you learn what to do right, you're not going to make all the mistakes that's going to delay you in having successful business. Also, that's another reason to talk to other travel agents or facilitators who are in the sector, because learn from other people's mistakes, learn from the best practices to actually do things right. And I'd also advise, if there's a medical tourism workshop or a wellness workshop or event, even in your region, and you're not able to make it to our annual conference, then go, because the biggest thing that I find is it's learning and interacting with people that are doing it. It's that interactivity and the advice and guidance and connections you get will take you so far. I mean, we see people who try to enter this industry and they try to do it themselves, and a year later they're telling us, we tried to contract with whether it's wellness retreats or hospitals, and it's taken us a year, and our goal was to have 10 contracts signed, and now we have 1 or 2, or we don't have any yet. And that's why you really need support and help in that area, because you shouldn't have those delays. You shouldn't have to worry about simple things. You want to be out there talking to the consumers, engaging them in marketing, not doing a lot of tremendous paperwork and back-end and development. And then as an as a nonprofit organization, we're actually building a global medical network that will include wellness retreats and hospitals that are going to be kind of a pass-through approach that travel agents can use, so they don't need to deal with the contracting phase. They can instantly have access, and they're going to make the same revenue that they would make had they gone and dealt directly with the facility, whether it's a wellness retreat or hospital, and they still deal with that same facility, but we're trying to facilitate that contracting in the beginning through our organization as a global organization, so there's not long delays in people getting into this space.
Yes,
there's another question that popped up that's in here that someone asked regarding the liability we covered, are there insurance policies that I can purchase that would cover me for this, for my business as a travel agent? So one thing is, if you have insurance right now, some type of errors and omissions insurance, I think it's important to reach out to them to ask, would you cover this? Because some of them might actually cover depending on what you're doing. For example, like wellness, wellness travel or tourism, they might say that's fine, but they might say for medical tourism and people traveling for medical procedures, we're not going to cover that. And that's where you can see that if you partner with a medical tourism facilitator, maybe they have an insurance policy they can indemnify you with. Or you can get the consumer to sign a patient waiver. And I think one important thing to really know about is there is complication insurance out there that you can purchase that will cover consumers for complications if they occur. And also is thinking about travel insurance. Now, I know, as a travel agent, you know about travel insurance, but the reality is that travel insurance isn't going to cover you for a medical procedure. So they will have exclusions. If you're traveling specifically for the purpose of a medical procedure, we're not covering you. So I think that's very important to know and to be transparent and disclose to the consumer that, you can't just buy a travel insurance policy and it's going to cover you if anything goes wrong. It's only going to cover you if something goes wrong that has nothing to do with the medical procedure. I know there's a another question that popped up, and I know we answered it. Will copy the presentation be available to download online? Is we're going to make available the actual whole video presentation within the next 24 to 48 hours for people to watch. Any other questions,
Another
Charles?
question, Jonathan, is what are the most popular destinations and treatments?
The interesting thing with that is that there, as I said earlier in the presentation, there are a lot of destinations, and 5 to 10 years ago, if you asked the question, like if we look at medical tourism, and 5 to 10 years ago, there was like 5 destinations, and now there's like 60 destinations around the world. So it really varies. And with wellness tourism, we're seeing the same thing. So we're seeing people going all over the world. There's almost, I think, 30 different destinations that are core destinations that people are traveling to. So another question that came up with how does physician-to-physician referrals or physician-to-patient referrals affect the role of the facilitator? Well, there are physicians that are referring patients to other physicians, and it's really going to be their choice of whether they use a travel agent or they use a facilitator to do that. So, in some cases they're not, and in some cases they're going to, and I think a good market would be to find those referring physicians and to create a relationship with them and to show them the value of using you as a facilitator.
Someone asked how to contact us for more information, and of course you can visit our website at www.medicaltourismassociation.com. The Congress website is medicaltourismcongress.com, and of course you can reach me directly at Charlie, C-H-A-R-L-I-E, at medicaltourismassociation.com, and we'll be more than happy to take as much time as we need with you to answer any questions you may have, and to be of service really in any way that we can.
Yeah, and I'd like to, there's just two other questions that came in just now that I'd like to answer just before we end the webcast. So one of them was, in my opinion, what's the role of a lawyer in a patient's medical tourism decision making? So that's, I'm assuming that question is really based on it's a healthcare consumer and them talking to their attorney about traveling. And that's really up to the healthcare consumer if they want to talk to their attorney. Literally, every patient consumer that I've interacted with, when you ask them about legal issues, liability, them being concerned with medical recourse, that they will go ahead and say that that doesn't even come into their mind, because their whole focus is on traveling for care and getting the best quality, and that their doctor is the best experienced surgeon and they're going to have a positive outcome. So I don't really know if a lawyer really has a role in this. I think, the consumers, there's a lot of transparency about them understanding that there's liability, and that if you bring litigation in a foreign country, most likely you're not going to get the recourse that you want. And so you're basically waiving your rights to bring litigation in your home country, and you have to bring it in that other country where you're going to get limited damages, or you may not even have recourse. So I think it's something that, it's something that you should be addressed. You could address it with your personal attorney, and depending on the procedure that you're going for. But as a consumer or as a travel agent, you want to advocate for the consumer. So you want to find out and make sure the patient's getting the right disclosures and they're protected. And, some clinics or hospitals will actually cover complications or provide guarantees. Another issue that was asked was, how is healthcare reform going to impact on travel agents' business? I think healthcare reform is going to be very positive here in the U.S. on travel agents' business, because you're going to have more people traveling for wellness. There's huge wellness incentives in the healthcare reform law. Employers can provide a 30% premium discount towards insurance, or you could view it another way, 30% penalty if people don't participate. If you participate in wellness, you get a 30% discount on your insurance each month. If you don't, 30% penalty. So a lot of employers are going to be implementing wellness because they see that as definitely a way to reduce costs. Also, for medical tourism, domestic and international medical tourism here in the U.S. is really going to grow, because healthcare reform significantly increases costs. A lot of people thought it was going to lower costs, but they didn't realize that it really doesn't do anything to reform costs, doesn't do anything to reform insurance premiums. And already in the past month or so, a lot of articles and a lot of insurance companies have been coming out to basically saying, get ready, costs are going up. And in one case we saw in California on the state exchanges, several insurance companies said, we're not going to offer our health insurance on the California state exchange. And the big one out there that did said they're going to be raising rates from anywhere from, I think it was 67% to 150% starting January 1st. Another question that was asked is, how long does the online certification take, and how much? The certification online is $1,500. And the course, you can finish it depending on how much time you want to put it in. You could try to do it all in one day, or you could take it over 2 days, or some people watch during their work week and an hour a night, so it could take them a week or two to finish. And then when you take the course, you're going to get the seal that you can put on your business card. You get the designation that you'll be able to put on your business card, your social media, say you're a certified medical tourism specialist, and then you're featured on our website, and there's a search functionality where people can contact you. So we're trying to promote people to use those people who are certified. One question that came in was, what percentage of a typical hospital's revenue comes from medical tourists? So there's really, two types of hospitals. There's a majority that are actually, the majority of them, they're not based upon medical tourism. There are new ones being built, or new ones that were just recently built, that their focus is just medical tourists. But I would say, you'll see anything from hospitals where it could be 1% to up to 10% of a hospital's revenue. And what they look at is they look at medical tourists as that kind of cream of the crop, a very profitable model based upon them having capacity in their hospital and free time. So it's something that they really enjoy, and it's something that they're trying to grow. And one question was the last question was talking about insurance for possible complications to the patient. What do you recommend, to a very new company? So I think you really want to look at and check out what are the different complication insurance companies that are out there and products and services. It's something that you can decide you're going to build into your packages, or it's an option that you can offer to your customer. And then you can also look at, if that doesn't fit within your model or the customers don't want it, is there anything you can negotiate with the hospitals on behalf of the consumer regarding complications, or just complications on the actual consumer where it's their liability. One thing you really have to think about is that if you send them to the best hospital and the best doctor, you're limiting your liability. That is the best insurance policy that you could have to reduce risk. And how long is that consumer staying in the country? There are some destinations and some hospitals that focus on profit. And so what they do is they try to get that customer to come and stay as little as possible at the hospital and country, do the procedure, and send them back to their home country. That's where problems can happen, because then complications happen. They're back in their home country. They can't fly. They have to have those complications to take care of in their home country, and their costs skyrocket. And now they've eliminated all the cost savings or all the benefits of traveling. So really what you want to do is talk to the hospital and the doctor as to what are the majority of complications for this procedure, how long should the patient be here, because when do these complications typically occur, and make sure the person's there. So that's another big way you're significantly reducing risk. So that's all the time we have for questions. If you'd like, you can email questions afterwards, and we'll be happy to answer them. And as I said, the webcast will be available in the next 24 to 48 hours. It'll be emailed out to everyone, so you can share it, watch it again, or share it with your colleagues. So I'd like to thank everyone for attending this session. We had a really great turnout, and everyone have a great week.